It's the planting season and 37-year-old Giovans prepares her fields. Then she gets all her children ready because today is an important day. She's taking 3 of her youngest of 5 children to the clinic to get them vaccinated against measles and rubella as part of a nationwide campaign targeting children under the age of 14. Measles is unfortunately a sickness she knows well. Last year, she says, there was an outbreak in the area. All 5 of her children got sick.
Ndivuga ngo iriya ni indwara mbi cyane mu buzima nabonye ndwaza abana ariko iriya niyo ndwara ya mbere nabonye mbi cyane kuko umwana arafatwa akagira umuriro mwinshi cyane hanyuma abahitwa ikindi arakorora akayi kadacika.
Fortunately, after receiving treatment from the clinic, they recovered. It's a small moment of pain for little Gift for a lifetime of protection against 2 deadly but preventable diseases. His older siblings seem to manage a little better. Over the last decade, Rwanda has managed to significantly reduce the number of measles cases, and last year, no deaths were reported. But while measles cases were on the decrease, over the last 3 years, the number of rubella cases has become more visible and increased. Rubella, sometimes known as German measles, has similar symptoms to measles and can be lethal to an unborn child if a pregnant woman contracts it.
It's extremely significant for child survival that the measles-rubella combined vaccine is able to be introduced into Rwanda today. It will literally save lives, and those girls who have been vaccinated today, the future mothers, are now also protected. So there's a layer of protection around the children and a layer of protection around the future children.
Rwanda is the first sub-Saharan African country to introduce the dual vaccine as part of its already stellar record of improving child survival. Having reduced its child mortality rate by 2/3, it's on track to meet and surpass the MDG4 by 2015. This success is the result of building an effective primary healthcare system at all levels. In villages, community health workers like Belina Desange have played a vital role in educating communities about the importance of the dual vaccine and making sure children are immunized either at clinics or at schools.
Nk'abajyanama b'ubuzima ubundi ikingira ryegereje dukora raporo y'abana bari mu gihe cyo gukingirwa, noneho iyo raporo tukayohereza kuri centre de santé tugasigarana n'indi kopi yo kugira ngo tumenye umubare w'ikingirwa ry'abana bazakingirwa. Noneho ikingira ryagera tukajya kuri kampanye aho iri tukamenya abana bakingiwe n'abatarakingirwa, tukagenda nk'ikigoroba tukajya mu ngo tukareba babana batakingiwe tubabaza udufishi.
In partnership with the government of Rwanda, the dual measles-rubella vaccine is made possible with support of the Gavi Alliance, WHO, UNICEF and others who are part of the Measles and Rubella Initiative.
Gavi's approach is very much led by the countries. So it was Rwanda who asked for this vaccine, as it's the case that countries ask for any of the vaccines that Gavi provides. We work closely with them, hand in glove with WHO and UNICEF, who work in the countries themselves to talk to the ministries of health about what's the most advisable. But Gavi then provides the funding for it once the country has applied for support from Gavi.
The aim is that by 2014 it will become part of the government's routine immunization program.
After we have that wide catch-up measles campaign, which in Rwanda we are targeting around 5 million children, after this campaign we are going to put rubella and measles combined vaccine into a routine immunization program, so that every child who have got 9 months will receive from now rubella and measles combined vaccine.
This means that more children like Ukwishaka, Hope and Gift will have the opportunity to lead healthy lives.